Hello, everyone. I'm Amanda. Please tell me when we are ready to start.
You're ready.
Okay. Hello, everyone. Welcome to another edition of the Brown Bag series in the GHB department. As all in the audience know, my name is Anna Langer, and I'm a professor of the practice in the department, and I also lead a program called the Women and Health Initiative. And it's my very distinct pleasure to introduce you to my colleague, Jewel Gausman, today. Jewel joined the Women and Health Initiative as a research associate in 2017 after having completed her doctorate program at the school in the Department of Social and Behavioral Sciences. She's now based in Ivory Coast, but she has extensively worked and is still working in Jordan. And she is going to present today the first results of a brand new study that we are doing now in that country. Her interests focus on studying health disparities with regard to sexual and reproductive health. In general, her project has focused on youth sexual and reproductive health in the Middle East, but more recently, she is also leading the research activities under the Improving Maternal Health Measurement Capacity and Use project in Ghana, India, and Argentina. So the floor is yours, Jewel. Jewel will speak for about 30 to 35 minutes, and then we would be very pleased to engage with you in a conversation. Thank you.
Okay, great. Hi, everyone. And I'm sorry I can't turn on my video because I'm having some bandwidth issues. As Anna mentioned, I'm based in Ivory Coast and the internet is just not cooperating today. So sorry about that. And hopefully you can all hear me and see my screen.
Yes, we can.
Okay, great. Thank you, Anna. Okay. And so as Dr. Langer mentioned, my name is Jewel Gausman, and I'm here to give you an overview of our study on social networks and sexual and gender-based violence, or SGBV, in Jordan, that was funded by the World Bank. And so in today's presentation, I'm going to discuss the study concept, the methodology, our experience conducting the research, including discussing some of the challenges that we faced along the way in working on such a sensitive topic in a fairly conservative setting. And then I want to go over some of the preliminary results as our analysis is still very much in progress. And so I'm going to start with going over the background and our theoretical orientation. And so first, for the purposes of our study, we define SGBV as any act of gender-based violence that results in or is likely to result in physical, sexual, or psychological harm or suffering to women. Our study is rooted in the social ecological model, and I'm sure that many of you are already familiar with it. Recent calls in the SGBV literature highlight the importance of understanding SGBV as an ecological issue that is embedded across different levels of context. And so determinants are thought to operate at the individual, family, peer, community, and society level. And attributes of these levels interact to create and reinforce norms, attitudes, and behaviors that can perpetuate or conversely challenge the practice. And so an individual's social network or the web of social relationships that an individual has is one way that the different levels of the social ecological model interact. And it's through one social network that norms, attitudes, and behaviors are constantly being reinforced and challenged by those relationships with other people, and also by new information before being projected onto future social interactions. And so we found that many SGBV interventions implemented globally draw on elements of social networks theory. For example, a common intervention design in the field of SGBV is to use community champions to change and challenge norms. But really, there are very few studies that use network data to explore how social relationships influence attitudes and behaviors related to SGBV. So we chose to focus our study in Jordan as we think it's a particularly interesting place for this type of research, and also it's very much needed. So first of all, in Jordan, SGBV is relatively common. Results from the 2017 Jordan Population and Family Health Survey, or the DHS, indicate that 26% of women have experienced some form of physical, sexual, or emotional violence since the age of 15. Physical, emotional, psychological, and verbal abuse, controlling behavior, intimidation are all commonly perpetrated against women by their fathers, family members, intimate partners, and other male community members. Further, controlling behavior displayed by husbands is relatively common, with 66% of women who have ever been married reporting that their husbands get angry if they speak with other men, and 32% insist on knowing their whereabouts at all times. And so those are just some examples of what women in Jordan face. Extreme forms of SGBV also do occur. While data are very scarce, the Jordanian government's 2014 submission to the UN Committee on the Rights of the Child reported 50 cases of honor killing between the years of the year 2000 and 2010. And of those cases, 12% of victims were under the age of 18, and 56% were between the ages of 18 and 28 years. And so youth are often particularly extra vulnerable to SGBV because of issues around gender discrimination, rigid social expectations, increasing economic hardship and poverty, and a lack of protective institutions, especially within the Jordanian context. Another issue in Jordan is that SGBV is also widely accepted. In fact, more younger women appear to tolerate SGBV than older women, which is a disturbing trend. And so the 2017 DHS reports that 63% of women between the ages of 15 and 19 years of age agree that a man is justified in hitting his wife for at least one reason, while only about 45% of older women agree. On average, Syrian women tend to be more likely to agree with at least one reason for wife beating than Jordanian women. So there are some differences across the population as well. Also, a 2013 survey of ninth graders found that 40% of boys and 20% of girls believe that killing a daughter, sister, or wife for dishonoring the family is justifiable. So both the high prevalence of SGBV itself and also the attitudes that support it make understanding SGBV from a social network perspective really important in Jordan, and potentially also very important to future intervention designs. And so another interesting thing about Jordan is that it's a very stable country, but it's surrounded by instability in the region. And so it's home to a really interesting and diverse population. There's a large population of refugees from across the region. And over the last decade, the war in Syria has led to huge inflows of refugees into the country. And so as a result of the Syrian crisis, there are over 1 million Syrian refugees living in Jordan, and only 16% of those are thought to live in camps. And so this puts a lot of strain on Jordan's host communities because they're just integrated into primarily urban areas. There are large populations of other refugee groups as well that have existed in Jordan historically. While the prevalence of SGBV in Jordan has declined overall in recent years, which is good, in some disadvantaged communities, especially those with a large population of refugees, there are some fears that sexual assault, rape, child marriage, and honor killing are all becoming increasingly common. There are very little data on refugees outside of camps. However, a qualitative study found in camps, women aged 12 to 18 years are thought to be the most common targets of domestic and sexual violence. And many youth have reported an increase in SGBV since coming to Jordan, which highlights an urgent need to focus on prevention. And so with that background about the context of Jordan, I'll shift my focus a bit to discuss the role of norms and personal beliefs related to SGBV. Social norms related to gender equity, women's value and their role in society, women's proper behavior, protection, violence, control, and power are all thought to contribute to the perpetration of SGBV, but there really has been relatively limited research in this domain. So in terms of how social norms influence behavior, individuals may engage in specific behaviors because they believe that most other people in their social groups also engage in that behavior. And this is known as what's called descriptive norms, or they may engage in a behavior because they view a certain behavior as expected or appropriate. And those are known as injunctive norms. So most studies tend to focus on individual attitudes rather than social norms, or they aggregate individual attitudes to measure norms. But norms and personal beliefs are not always aligned. Individuals may feel pressure to conform to a norm, even if they personally disagree with it. And so the idea of pluralistic ignorance is helpful here, which is the idea that individuals often believe that members of their community have different attitudes than their own. And they often overestimate the prevalence of harmful attitudes and behaviors and underestimate protective ones. So you can see how this would be important in understanding the normative context around SGBV and then behavior. And so now with that framing, our study aims to understand how norms, attitudes, and behaviors related to SGBV and gender inequity are developed and transmitted across youth social networks in Jordan at different levels of the social ecological model. Our ultimate goal is to recommend evidence-based network approaches to create transformative change at the community level. And so this project is led by us at the Women in Health Initiative, and we have partners from the University of Jordan School of Nursing and the Jordanian Hashemite Fund for Human Development, or JOHUD. Our partners at the University of Jordan focused on ensuring contextual relevance and acceptability of our study design, tools, training field staff, and overseeing research activities. And they're also very focused on in-country utilization and dissemination of the results and trying to get key stakeholders engaged in our work. While our other partner, JOHUD, is one of Jordan's oldest local NGOs. They implement a wide variety of community development programs focused on health, civil society, education, and livelihoods. And they have community development centers located throughout Jordan, and they're a very well-trusted entity within Jordanian communities. Our partnership for the study actually builds on our past successful experience implementing a research study with the same team focused on adolescent sexual and reproductive health. So we now thankfully have a pretty well-oiled machine in terms of our partnership, which has just been really great to work with. And as I mentioned previously, the study was funded by the World Bank Sexual Violence Research Initiative as a one-year project, but this timeline was altered due to COVID-19, and I'll discuss some of those challenges in more detail shortly. And so the specific aims of our research project are to examine the prevalence of SGBV in the study population as it relates to key social, demographic, and health-related variables, to describe how attributes of youth social networks are associated with normative beliefs related to SGBV through hypothesized mechanisms of influence, and to explore how different social contexts may influence attitudes and normative beliefs related to SGBV. We designed our study as a cross-sectional egocentric study, which is the most common type of network study. It's much more feasible and practical and less resource intensive than other types of network studies. Egocentric means that we're mostly interested in how the study participant views individuals in their network. And so this is opposed to a sociometric study, which collects data on all individuals in a network. So for example, there would be a census of everyone in a school or everyone in a specific community. And you can imagine how resource and time intensive that kind of study would be. Our study took place in East Amman, which is a disadvantaged urban area with a large population of refugees from across the region. And we randomly selected participants who came into 4 different JOHUD centers for other reasons, to access programs or other things going on. We plan to include about just under 1,000 youth in the study for our sample size. And so we collected data on a range of topics through the survey, including socio-demographic characteristics such as marital status, educational attainment, wealth, refugee status, etc. We also included modules on women's and men's experience of violence and men's perpetration of violence. We included a module on mental health and also social support. But the bulk of our study was focused on norms and personal beliefs about SGBV and social network elicitation. And I'll talk more about both of those areas more in depth in just a minute. So in terms of developing the tools, it was a lengthy process that required extensive coordination and negotiation with our study partners. Thankfully, we used previously validated surveys when possible, and we were really lucky that we were able to access many of the modules and surveys that we incorporated into our survey. In particular, the women's violence module that had already been implemented and validated and translated into Arabic and had been used in Jordan before. Translating between English and Arabic is not an easy task. Ensuring clear understanding and word choice was a challenge. There are important sensitivities around the use of certain words in Arabic versus in English, and we had to address those subtleties, especially in dealing with such nuanced questions as we were interested in. We pilot tested the tool with 50 participants from the study community, which helped us ensure that the tool was understandable. And it also gave the data collectors really important practice using the tool and the methodology because it was new to them. The field research team, while they all had past experience conducting research studies on somewhat similar topics, they required significant training on study procedures, ethics, and sensitization, given the sensitivity of the topic. In particular, we used tablets to collect data and a web version of REDCap, and that took a lot of practice for some data collectors to get used to. There were some hiccups in formatting, especially working with Arabic text and right to left page orientation. We also, some of the more sensitive survey modules, like the women's and men's module on violence, we actually, it was great to use the tablets because we could do them as self-administered surveys, which I think really improved the validity of our responses. But that was also a challenge for the data collectors to kind of navigate. And so they had to, it was helpful to have some practice getting used to that. Also, we had some issues with network connectivity, but we were able to overcome those issues, thankfully. And so now to focus a bit more on how we measured social norms and personal beliefs. We went through a collaborative process with our field partners to ensure content validity. We drew an initial pool of 13 items from the existing literature globally and in the region relating to gender norms and equity and sexual and gender-based violence, including child marriage and honor killing. We then consulted with local experts and academics to revise the items to ensure cultural relevance and to add any additional items. And so we ended up with 27 items reflecting social norms related to SGBV. We focused specifically on measuring injunctive norms, as I mentioned, social expectations. And were asked the extent to which they believed other members of their community would endorse a given normative statement. And the responses ranged from 1 to 5 or between none or all members of the community. We then reworded each question and asked them how they personally felt about each statement, whether they strongly disagreed or strongly agreed with the score again on a scale of 1 to 5. And so both scales were aligned so that the higher score meant greater perceived community or personal endorsement of the harmful or gender inequitable social norms in the scale. So here you can see some examples from the scale, and I'll pause for a moment to let you read through them. But for example, a lot of items focused on gender norms, physical violence, and norms around reporting violence to authorities, et cetera. And so now to collect social network data, the goal is to collect information with, and so we want to capture close relationships, but also influential and more distal or distant relationships. And to do this, we used a series of questions called name generators, which are designed to get participants thinking about the people in their network. And so in our case, we focused our name generators on those that emphasize different aspects of social support provision. And so you can see the 4 questions that we asked on the slide, asking participants to name people who they enjoy socializing with, they go to for advice, and who they would borrow a basic household item from. And so participants could name up to 5 individuals for each of these questions, and we didn't allow any duplicates. The individuals named by the participant are called alters in social network speak. So just to clarify some of the terms used here. The use of multiple name generators is thought to yield a more accurate and complete estimate of an individual's social network. So to make the participant more comfortable, as asking about personal relationships may be somewhat sensitive, we said that the participant could give us initials or a nickname or any other reference to the person that they would remember. This is also for the sake of preserving confidentiality. The participant didn't need to provide us with their alter's real names, so long as the participants knew who we were talking about when we referred to a particular alter in follow-up questions. Then the interviewer guided participants through a series of questions about each alter. We asked them about the alter's gender, nationality, type of relationship with the alter, the frequency of communication with them, whether they would be comfortable disagreeing on a sensitive topic with the alter, and how the participant believes that each alter would respond to questions related to SGBV, such as, would person X believe that honor killing can be relationship between each alter? For example, whether person A and person B identified by the participant knew each other. And so you can see how using an automated tablet-based program would be really helpful in order to make this process more feasible. But even then, this module in some cases got quite long. And so in implementing the study, we definitely faced some important challenges worth discussing. The questions were quite sensitive, especially those around men's perpetration, and even more so men's experience of violence. And after extensive discussions with partners, we wound up having to exclude questions related to men as victims of violence, as many of them focused on sexual violence. Our community partner was ultimately too afraid of backlash if it got out that they were asking questions about sexual violence involving men as both perpetrators and victims, given the conservative culture. Additionally, we faced a lot of sensitivity around whether we could include unmarried women in the WHO Intimate Partner Violence module. Our study partners thought that asking unmarried women if they had ever been in a romantic relationship would be far too sensitive and culturally offensive. But one of the really important aspects of the study is that we include unmarried women who are often not included in research in Jordan. And there really is very little known about their sexual and reproductive health issues. It's just a huge research gap. So eventually we found a compromise, and we were able to include unmarried women who said that they had been in a quote unquote love story, which was code for a romantic relationship outside of marriage, often considered kind of a precursor or similar to engagement. To our local partner's surprise, a much larger proportion of women actually responded yes to the love story question than men, and a substantial percent of women were included in the module. Additionally, while youth are typically defined between the ages of 15 and 24 years of age, and youth are of specific interest in the study, we made the deliberate decision to only include youth who had reached the age of majority or the age of 18 years and above. And we made this decision for several reasons. It was to ensure that the respondents were able to give full informed consent, but also to reduce risk to participants by avoiding the need for parental permission, as some of our questions asked about family violence. Finally, we also had a lot of, as I mentioned earlier, we had a lot of difficulty with regards to the coronavirus pandemic. Just as we were about to launch field data collection back in the spring of 2020, the pandemic hit. Jordan was very heavily affected, and the government implemented one of the harshest lockdowns in the world. We had to put our research on hold for many months, and we began discussions with the funder about the ethics of conducting this research remotely by phone or by web link, given that we had no idea when we'd be able to return to the field at that time. While there have been some SGBV studies globally that were able to convert to remote data collection during this time, and they had good experiences, we ultimately decided that it wasn't a possibility in Jordan, given how closely women's behavior is monitored and the potential for some very extreme repercussions. So we ultimately just had to wait out the pandemic, and then we seized the moment when caseload started to lighten and restrictions were lifted. Ultimately, our research was delayed almost a year, and recruitment was slower than expected, as movement was still reduced when we started collecting data. Okay, so now I'm going to transition just a little bit. And I'm going to spend the last part of our time today giving you a preview of some of our results. And so again, this is very much a work in progress. So data analysis is still underway, but I thought it would be nice to show you how we're approaching one of our analytical streams about social networks. And so we're currently conducting an analysis examining social relationships and peer influence on attitude. With this study, we first explored the distribution of youth in Jordan who believe that honor killing can be justified. And we examined the association between the participants' beliefs about honor killing and the relational attributes of their altars. I just got a notice saying that my connection is unstable, and I just want to make sure that everyone can still hear me.
Yes, we can hear you. I was about to tell you, but I think that in general, well, the disruptions are very short and we can follow you. But
okay.
Yeah, there is some.
Okay, great. I was worried. Okay, great. Okay, and so now I'm going to switch to using some more social network language and talking about this analysis. So when I use the word ego from here on out, I'm referring to the study participants themselves, whereas as I mentioned, the word alter refers to the people in the ego's network. And so our outcome variable in this case is defined at the ego level, and it is whether the ego believes that honor killing can be justified. In our analysis, we consider a number of ego level characteristics, including gender, educational attainment, wealth, marital status, and the number of alters they identify, which we factor into the analysis. And our exposure of interest is defined at the alter level, and that is whether the alter believes that honor killing can be justified. We include the covariates that we have on the alter that I previously mentioned, such as the alter's gender, nationality, type of relationship, frequency of communication, and comfort level of the ego in disagreeing with the alter. And so all alter level variables are the ego's perception of the alter. We didn't follow up with the alter at all. And for analytical purposes, we store this data as ego alter dyads. So we use logistic regression analysis at the ego level and then at the ego alter dyad level to explore research questions. And so at the ego alter dyad level, each ego contributes between 1 and 15 ultimately observations to the data set, which violates assumptions around independence of observations and would bias the results.
This last part, we couldn't
We clustered the standard errors at the ego level for the number of alters named by the ego. In our analysis, yes. Can you hear me now?
No. Yes, we can, but we couldn't hear you well when you were describing the analysis of the ego alter dyads.
Okay, so just in short, the ego alter, when we perform the analysis at the ego alter dyad level, each ego contributes between 1 and 15 observations to the data, which violates assumptions around independence of observations and would produce biased results. So we cluster the standard errors at the ego level, and then we adjust for the number of alters named by the ego to handle that. We also explore the exposure of interest, which is the alter's attitude toward honor killing. We also looked at interactions that honor killing can be justified, modified by both ego and alter characteristics. And so here you can see the population of egos in the study. In all, we had 821 respondents split fairly evenly between men and women. Most respondents were Jordanian and were unmarried. And from this table, you can also see the very high proportion of egos that believed honor killing can be justified. In our sample, more than 30% of respondents believed honor killing was justifiable. And we were very surprised by this finding. And on this slide, you can see the altar characteristics, and I'm not going to spend too much time on this, but in all, we had data on 2,714 ego altar dyads that we included. Most relationships you can see are clustered by people of the same nationality and the same gender. And so here you can see the distribution of egos who believe that honor killing can be justified. There's a huge disparity between men and women. And we were again very surprised to see that nearly 50% of men in the sample believe that honor killing could be justified, compared to about 16% of women. We can see on the far right in the adjusted models that higher education, university level or higher, and having been married is associated with lower odds of believing that honor killing can be justified. We didn't find significant variation by wealth or nationality in the adjusted model. And so on this next slide, I just wanted to very quickly touch on some of our initial regression results. Again, just to say this is a work in progress. We found a strong positive association between an altar's beliefs, who have an altar who believes. I got another notification, hopefully you could hear me. We found that egos who have an altar who believes that honor killing can be justified have over 5 times the odds of having the same belief compared to egos who don't have an altar that endorses the practice. Attitude toward honor killing, or ego's comfort level disagreeing with the altar. Sorry, what was that, Anna?
No, I was encouraging the audience to read the slide because your voice again was a little distorted.
Okay, I'll pause here then for a minute to give people a chance to read. And then I'll move on. I only have a couple slides left.
Thank you. I think you can continue now.
Okay. And so on this slide, the results are stratified by ego's gender, type of relationship with the altar, and ego's comfort level with the altar to help understand the interaction terms more clearly. So these models are adjusted for ego and altar characteristics and network degree. See that women who have an altar who believes that honor killing can be justified have more than 10 times the odds of believing the same thing compared to a woman whose altar does not endorse honor killing. Whereas the magnitude of the association is much less for men. Similarly, we can see that egos with a family member who believe of endorsing the practice themselves compared to egos whose family members do not support the practice. The strength of the association seems to decrease with more distant relationship types. And we also see a similar pattern with regard to ego's comfort disagreeing with the altar, which I think reinforces the results that we see with the relationship type. And so in short, we found that a large proportion of the study population endorses honor killing, which is sadly in line with the study that I mentioned earlier that was conducted about a decade ago. And it implies that little has changed over time. We also find that attitudes are heavily clustered within close relationships, so family mostly, but family and friends as well, potentially suggesting that relationships among close social contacts may be particularly influential, and women in particular may be more strongly influenced by people in their network. Conversely, we found that community leaders, religious leaders, and teachers appeared to have somewhat limited influence, though again, our study can't assess causality. And the results apply that peer-to-peer or perhaps family-based interventions may be effective, given what we're seeing in the data. And so we have a lot of work left to do digging into this data. And I've highlighted a few next steps with regards to our analysis here. So there's a lot more to come. But we're currently undertaking analysis to validate the SGBV norm scale that I presented. We're looking at the discordance between social norms and personal beliefs in relation to behavior. We're conducting an analysis to explore network structure and composition vis-a-vis attitudes towards SGBV. So looking at network characteristics like homophily, which is how similar people are to others in their network, density, which looks at the extent of relationships or ties between members of a network, and other ways to look at social support. And then we also are looking at the prevalence of intimate partner violence among the study population, including unmarried women, which we think will make an important contribution to the literature. And so that is all I have for today. I hope to share most of it. So thank you so much. And now I'd like to invite any questions or comments that you may have.
Thank you so much. Now that you will turn off the slides, maybe you can turn on your camera and we can see you. At least we can try, or you can try rather. And now the floor is open. Any questions or comments for Jewel? No questions? Yes, Dan, please go ahead. Dan, can you hear me? I'm not muted, am I? No.
No, I think he's muted.
Oh, Dan, you might be muted.
Yes.
Oh, but now we can hear you.
Good. So thank you very much for your presentation. It sounds like wonderful work. When I was at WHO a couple of decades ago, the reproductive rights group put out some guidelines on the kind of sexual partner violence that were surprising in one respect. They specifically directed the researchers to they told the researchers when they went to a household and they wanted to talk to the woman ultimately about whether she was being abused, they anticipated that the door would be opened by her husband and that they would have access to the wife only with his agreement. And they also anticipated that if they told him what the actual purpose of their visit was, there was no chance that they would ever, in most cases, that they would ever see the wife. So they directed the researcher to tell him that they were going to be asking about a bunch of gynecological questions, with the premise that he would feel rather uncomfortable about it and it would immediately usher them in to talk about the wife and then excuse himself. Whereupon they would say, ask, is he beating you? So that was a surprise because, ordinarily the legal department of WHO is very insistent on being completely upfront about what the studies are about. But in this case, the researcher was almost specifically urged to dissemble. So I wondered, first of all, is that, in your knowledge, is that guideline still around, and are people aware of it, and what are your practices?
Yeah, so as far as the guidelines, I'm not sure exactly what the instructions are for the survey when conducted as a household survey. I know that a lot of precautions are taken, obviously, to ensure safety. I mean, a lot of best practices in conducting sexual and gender-based violence research suggest that interviews shouldn't take place at home, so that the woman can be the woman's in a private environment where there's no risk of intrusion or backlash by her partner. And so what we did is that's one of the reasons why we recruited from that problem, where the women could come alone. We also took another safeguard where we only recruited women from certain sites, and we recruited only men from other sites. So in case a woman came to the Johud Center with her brother or her father or a male partner, so that there was no possibility that they would be recruited together for the same study, thereby telling the male partner what the study was about. And so that's another way how we handled ensuring privacy in this environment.
Yeah. So you didn't go to homes, basically.
No, we didn't go to homes. No, so it was just a sample from, we thought it was far too risky given the environment.
Right. I could ask you hypothetically, if you had gone to homes, what would you have done? Would you have given one version to the husband at the door and that wasn't really truthful in order to get around this problem?
Yeah, I mean, I think, my preference would be to do the interview at, I think, maybe giving the husband or, another male member of the family generalities if it had to be done at the home, giving very general terms and maybe engaging them in a much less sensitive version, maybe not even on violence, on health or something, something related. I don't know the context.
Yeah, that's pretty much what the guidelines urged. Thank you.
Stephen?
Thank you very much. This has been a splendid presentation. Your methodology is extremely fascinating for those of us who have not conducted such studies. What occurs to me is that I've observed in the literature regarding the way the UN system responds to Jordan's practices in this area, that Jordan has been praised for establishing shelters for women who fear or have been victims of fear honor killings or honor crimes, as they're called. And I was wondering whether the existence of those shelters was anything that your respondents were aware of and if it had any impact. And a related question is whether or not the criminal code regarding these acts as being criminalized is being adequately implemented. There have also been observations made regarding the inadequacy of the criminal code, but still there are, for example, the attenuating circumstances of honor killing is not covered in the criminal code. Is there any discussion or awareness among the people you're working with about the criminalization of these practices? Thanks.
Thanks for that question. Very interesting. So I do know that Jordan does get a lot of international praise for a lot of its work in this area. And there have been kind of high-level government initiatives about, like you mentioned, setting up centers and setting up sort of institutional safety mechanisms for women. I believe that there is some, locally, some criticism that these centers, are kind of few and far between, not really well known, and not, I guess, very widely implemented. And so women don't really have an easy time. It's not easy for women to access these centers. And in terms of the criminal code, I do know that there were some changes. Honor killing was legal, I believe. I think the law changed maybe about a decade ago, but there still are some legal loopholes.
2013, I think, was the date.
And in particular, I know that there's one, there currently are some loopholes around men who commit honor killings in a fit of passion or a of rage, and they get reduced sentences. And so I know that there's been a lot of attention paid to that recently. And so enforcement, definitely could be strengthened. And I read a recent, or it wasn't that recent, but I read a study that looked at records, sort of forensic records of judicial cases about honor killing. And it was pretty disappointing, the enforcement of, the penal code and criminal penalties against the perpetrators of these crimes.
Thank you. Any other questions or comments for Jewel?
Hi,
Yes, Chris.
Jewel. Yeah, just a question on the measurement. I know in HIV we use methods like ACASI, which is like tablets to try to have headphones to have people ask questions, doing other types of activities and technology to try to take the interviewer bias out. I was just wondering, what are your thoughts for others doing IPV work on how you went through selecting the tools, interviewers, recruiters, those types of key things to getting the right information from the participants?
Yeah, that's a great question. And so I mentioned that the module on intimate partner violence and also the men's module on perpetration and experience of violence, both of those modules were self-administered on tablets. And we were lucky that, in the Jordanian context, literacy is really high. And so we didn't face problems with participants not being able to read, which would have, introduced another challenge and, maybe would have required, some sort of technological adaptations. But thankfully, we didn't have to deal with that. And, I really do think that using that approach really helped us to get more, truthful responses. And like you said, it took away some of that bias. I think that in particular, the questions about, for unmarried women, just because of, the incredible sensitivity around unmarried women being involved in any sort of romantic relationship. I really think that it would have been a challenge to get reliable, validated, had to ask the questions. And so I think that this really helped. And I also think that it really helped with the men's survey as well, in terms of, admissions of perpetration of violence. But it was a challenge. And again, this population was not only literate, but also they're pretty technologically literate. Smartphone penetration is pretty high. People have, a lot of facility with technology. And so I think that also really helped, but still, it required some extra training on the part of the data collectors to get them comfortable, looking at cues and stuff, when to, hand over the or to take back the tablets, when to kind of intervene, looking at, nonverbal cues of the participant, signs of distress, et cetera.
Excellent, thank you. So just a quick follow-up. So for your interviewers, we always wonder, should we get younger women, older women, or how did you think about the interviewers, not necessarily for those questions, but the people administering? And like, who are they? Are they clinical staff or community members? Yeah.
Yeah, so we are the local partner, Joe Hood, has they have staff that they use for research that they've used before for data collection. And generally the staff that we've used are for this population probably about the same age, maybe a little bit older, but definitely the same gender as participants. The data collectors are sort of trusted entities, not only because they're affiliated with the center, but they're kind of, trusted resources in the community, which, I think is, could be a good thing, could also introduce some challenges, especially, if they were the ones asking the questions. I think it could really go both ways, but it certainly is tricky
Great, thank you.
with how to manage that. But we've generally had a pretty good experience, I think, with the data collector, and feel like in our qualitative studies that we've done, not part of this study, but in our past research on sexual and reproductive health with youth in Jordan, we used some of the same data collectors. And the results, they were really able to get participants to open up.
Now we lost you, Jewel.
It was a very good response. Thanks.
Thanks. Sorry,
Thank
my
you.
connection dropped off for a second, but I'm back now. So hopefully I got everything.
Any other questions or comments for Jewel? Emily.
Hi, thank you so much for this presentation. I was noting that you mentioned that smartphone usage is quite high among this youth population. And so given that, I was wondering what access to social media looks like among participants, and whether this plays a role at all in influencing youth's attitudes towards these types of behaviors. And if so, if that's something that would be relevant in this type of study, just kind of general influence of social media and what that looks like in this kind of network analysis, if it's relevant at all.
Jewel, are you there? Oh no. Oh, maybe you should move a little. Or... We cannot hear you now, and your image is frozen.
That's a really interesting question. I know that social media. Okay, I stopped my video. Hopefully, it will help save it with. Hopefully, this helps.
Yes.
Can you hear me now?
Yes, it helps. Yes, we can.
Okay. Okay. So generally, social media usage is pretty high among the youth population, especially in Jordan. It's a really interesting question, thinking about the influence of social media. We don't have any data on sort of social media, connections from a network perspective, but we actually did ask respondents about their access to the internet and the regularity of access, accessing social media sites. So that's, something that we, can actually look at to some extent with our data. And I think it's really important.
Super interesting. Thank you.
Yeah, thanks.
Well, thank you all. Are there any further questions or comments? Otherwise, maybe we can stop here and think of ourselves as lucky because we managed to listen to Jewel's full presentation and we had a chance to discuss some of the findings. So thank you so much for your interest. Thank you, Jewel, for a wonderful presentation. And we'll see you next Thursday.